and so on. So again, this was that second bucket, trying to get to true interoperability, and there's many other players here, but this just gives you an idea of some of the complexities. And when we started looking at the health information exchanges, obviously there was this goal of having kind of a center point for all the data to go through and be a kind of a conduit for the sharing of that data. And what we've done in recent years is kind of reimagine that commitment to place at the center the patient themselves, and putting them in control of their data and deciding who they can share it with, making sure they have access to it from all of these places as well. And one of the ways that we've been able to measure some of that success is what we call VDT rates. Everybody here heard of VDT? Okay. All right, it's not a sexually transmitted disease, but it's the ability for a patient or their proxy to view, download, and transmit their data. Sorry. And if you look at these statistics, in the last 2 years, according to a recently released ONC survey data brief, you'll see that actually we're less than, or pretty much every state in the country was less than 20% with that ability on average in those states, to where today we now have all of the states being over 40% and most of them in that 60 to 80%, again, on average in those states. We know there are still many problems with people getting access to their data, but nonetheless. But when trying to think of how can government play a role in this and how can we try to push innovation in healthcare technology, just as any other government agency, you tend to think of two ways that government can influence the markets, right? One of those is the carrot. What are those incentives? And we've done a lot of work in that already, helping to incentivize the adoption of EHRs and funding these HIE networks in the regions and states. Or the sticks, right? There's the penalties, the regulations that can come down through HIPAA violations to make sure that we're empowering people to have access to their data with HIPAA and penalizing those who aren't protecting it. Or certifying health IT products to make sure that they do meet with the certification standards for meaningful use, et cetera. But what I'm going to talk a little bit about today, because we're talking about innovation, and also with our dwindling budgets, this is where we have to focus anyhow, a lot of our time and effort, is this third area that a lot of people tend to overlook when it comes to government. And this is how can we shed light, bring clarity, and increase collaboration on all of the innovations that are going on out there. How can we make it easier to navigate the regulatory environment and understanding kind of what are the best practices that are out there? How do we diffuse the knowledge, so to speak? So one of these soft examples, not a carrot, not a stick, was the Blue Button Initiative, and I believe our colleague, Mr. Scrimshire from CMS, was talking about Blue Button on Fire earlier. But this was just more of a national awareness campaign, something to make it easy for others to raise their hand and say, I want to make it easily available for our patients to get access to their data. They see this logo, they can know that they can download it and get a hold of their data. This is an interoperability pledge that our national coordinator from earlier this year worked really hard with all of these industry organizations, advocacy organizations, you name it, to try to encourage them to agree to 3 core commitments. And this was no information blocking, consumer access to their data, and working on unified interoperability standards. And then these are some of the other examples you're probably very familiar with, and I'm going to talk about some that you're probably not. But the interoperability roadmap that we put out, we released something earlier this year called an EHR contracts guide. So if you don't have an EHR, this helps you figure out how to contract for an EHR in the most optimal way so your hands aren't tied when you roll it out and implement it. We put out a patient engagement playbook, and I'll talk a little bit more about that in a second. And then, of course, our health IT dashboard is always a resource that has all these statistics and data available for you to look. But earlier this year, we did also launch something in partnership with the Federal Trade Commission, the FDA, Office of Civilian Rights, et cetera. And this is anybody in here an app developer? I'm sure there's a couple at least, a few, right? So if you haven't already been on this, or maybe you're already way past this point, but nonetheless, it's a very simple online, web-based kind of quiz survey form. think of it like as TurboTax for understanding the federal regulatory environment. You just go on here, you start answering a couple quick questions, and it helps you get, and it spits out at the end, it'll spit out a little list of here are the regulations you should be looking at. So it's not something that I would say, hey, you'll never need a lawyer in your life, and you can start a business, and hey, this will be good to go. But it should give you a heads-up start on what you should be thinking about as you're beginning to build your mobile health IT app. Something else we launched was the Health IT Playbook, and this was an effort to make it much easier to find and navigate all of those different resources that are available to you out there. Certainly everything from ONC, but we're also coordinating, as we're supposed to, with all of our federal partners, CMS, FDA, et cetera, to try and capture as many of their resources that they've put out as well. Sometimes you find we've put out a resource, they've put out a resource, and they're kind of overlapping. But it makes it very easy to navigate and find those, and also they're beginning to look at which ones need to be updated. And this playbook model is something, the reason why we use the term playbook is because the idea is a playbook is never final, right? It always evolves with the season, with the games you play, et cetera. So it's an evolving set of resources that needs to be updated with the latest and greatest for best practices and leading edge technology, et cetera. So one of the ones that I mentioned briefly before was the patient engagement playbook, and this was not just providing a link to something that was already developed, but we actually worked to make something that was not only showcasing real-world best practices out there and highlighting the use cases for this. And we think that's important because that way somebody who's looking to do something in a certain area can reach out to somebody else and say, how'd you do that? And they're able to understand exactly how they implement it and see if it's a good fit for them. But we also made it highly interactive, easy to share. You can share any aspect of it if you like it. If you're in a certain section on patient-generated health data, for instance, you can just click your social media button and it'll pre-generate your tweet or your other post. And again, make it easy for you also to see the various roles within a care setting for patient engagement. So if you haven't already taken a look at this, I would recommend that you do. You'll see in the bottom left-hand corner was a feature that we did a lot of user-centered design on, and this was the idea of myth versus realities. It's very hard to get government to put out documents like this because they like to be letter of the law. And in this case, we said, these are very common myths when it comes to patient engagement, and then it allows you to kind of toggle back and forth between the reality. We also launched something earlier this year, and this is a bit of a change in our approach to how we conduct our work. But we launched something called the ONC Tech Lab. Has anybody here heard of this before? We kicked it, I know you did. We kicked it off, and although we have many people that we collaborate with frequently and that do participate in our federal advisory committees, there are still many people who don't know about them and don't know how to get involved. And this was an attempt to not only make it easier for us to collaborate and make it easier to see all the work that ONC is doing with our outside stakeholders, but also even within ONC and within the federal government to try to bring clarity to the type of health technology work that we do. So with this, we focused in 4 key areas. The first being pilots. We've funded a lot of pilot work in the past through cooperative agreements, through grant programs. We're going to continue to do that. We also focused on the second area is standards coordination. This is something we're very well known for doing with the Interoperability Standards Advisory. I'll show you a little more on that. Testing and utilities. We actually have a number of resources for you to test your products out. Similar to a GitHub type of repository where you can collaborate in that environment as you're testing out your products. And then our innovation category. And so when we talk about each of those 4 categories, and I'll give you some more recent examples of those or some of the more popular ones, I want you to notice that everything that we're doing in these 4 buckets has an alignment with these open innovation strategies that have been put out by the Government Accountability Office earlier this year. And this is crowdsourcing and citizen science, idea generation, open data collaboration, open dialogue, and prize competition or challenges. Now, we've already done some of these in the past, but we're starting to make sure that they overlap and they support all the aspects of the agency. So if we have one area that works on one specific program, we try to figure out how can we bring more open innovation type approaches to the work that they're doing. One of the first examples, we launched this at HIMSS earlier this year, was the Interoperability Proving Ground, or IPG. And this is an open community-sourced project where anybody can go on. If you got an interoperability project, you can put it into this platform, get some attention and awareness of it. You can tag your project, so if it's a fire project like Mark Scrimshire's work with the Blue Button on Fire, you can tag it with fire, and you can subscribe to getting updates whenever there's another fire project that comes out. And the idea here is that too often we focus on the work that's not being done, or where the pain points or the problems are, the frustrations. And through this type of platform, we can actually start to showcase that there are success stories and encourage and remind ourselves that we are making progress. And make it easier for those who are starting out on a specific project to not have to start from scratch, but see if it's already been done somewhere else, reach out to them, and get some information and see if they can partner. We also continue to do the draft, or the Interoperability Standards Advisory, or ISAs as we call them. Standards evolve constantly, ever evolving and growing. There's always a new shiny object to move to and take a look at. And so this is our best attempt every year, and it's almost a year-round process, to work with the community of stakeholders, not just sit in an ivory tower and tell you this is the standard that we want you to use and everyone should use, but work with people and say, give us public feedback, let us know what else is missing in here, what isn't in here, and see if there's more information that we need to include in it. And we break it down by different categories of standards in healthcare technology, and we're working to make the entire process much more open and collaborative, and hopefully easier to navigate, because as it currently and historically has been, it's pretty technical, highly technical language-wise and complicated. This is the site. This is the Standards Implementation and Testing Environment, or SITE, resource that we have. And again, this is that GitHub type of resource where you can go on and you can test how your implementation is going, test your products out against it, CCDA, direct transmit, whatever you like. These are just some of the sandboxes that we have in there. If you go to that site, you'll see there's pages of them. This is all free and available. We're one of the first agencies in federal government, period, not just in HHS, ONC was, to run challenges and app challenges. We partnered with Health 2.0 and many of the people in this room on running a lot of our challenges. And these aren't always just app challenges. Occasionally they're also an idea challenge, like our blockchain challenge was earlier this year, where we're looking for some sort of a collection of white papers on, what are the practical implications for this technology in healthcare? And when there's a lot of buzz about it, how do we sift through that and showcase those? And then you can see the Consumer Health Data Aggregator Challenge and the Provider UX Challenge. Those are both focused on specifically using FHIR, and the reason why was to try to, again, get more people playing in the sandbox because we believed in its promise. And the Move Health Data Forward Challenge was all about having the patient be in control of their data, not necessarily to download it like in the Consumer Data Aggregator, but just to decide who it goes to. So almost a consumer-mediated exchange of that data. Yeah, sure. And again, we're involved in just about every national initiative and national priority when it comes to healthcare. In one way or another, we're usually the technical subject matter expert in the room trying to recommend, okay, this is what you want to do, here's how you can achieve it or do it. And as we look to the future, obviously national priorities may change, but nonetheless, we think that if we focus on these three drivers for success, that they're going to maintain throughout any administration. And again, this is on the business case for interoperability, helping people understand the value of it to their business, the common standards on a national level, getting everyone on the same page, speaking the same language, and then the culture change around that access to information, having people let go and understand that the data needs to flow. And so, although 2016 had a lot of surprises, and I think that it was a year where maybe some of you didn't like the outcomes of certain events. I'm going to talk about one of them real quick specifically. Some of you maybe were very happy about the outcome of that event. Personally, I was extremely happy. For those of you who don't know, I am from Chicago. And having the Cubs win the World Series after 108 years is it just proves that anything can happen, right? And so certainly if there's commitment and never giving up to it, and that you have to just believe it's going to happen. So thank you very much.
Go Cubbies. Thank you, Stephen, for that enlightening discussion.